Hi, Dr. Henry. I'm wondering about some areas of Surrey that are persistently seeing higher cases, and some of them that are struggling with the vaccination uptake, as you mentioned on Thursday, perhaps not registering. Or what are we seeing in terms of, again, is it vaccine hesitancy? Is it communities that are not getting the proper information to go to certain clinics, and what's the strategy in going forward since the pop-ups had some of their challenges? What will be the strategy to getting those communities vaccinated as fast as possible?
Yeah, so we've been looking into that, obviously, with Fraser Health and with our team provincially, and it's a combination of a lot of things. We know that one of the reasons why case rates are quite high is because many people in communities in and around Surrey are essential workers, people who must go into work, whether it's childcare or healthcare or working in grocery stores or in food production. So we know there's a lot of that. We also know that there are many people who live in large multi-generational families, and where transmission can go quite widely in families, and that there are some barriers around language, and that we need to continue to reach out through community groups to make sure that we have the right information that people need to make the right choices at the right time. So all of those things are things we're looking at. I know on the weekend, for example, Fraser Health teams were out in a number of the gurdwaras in around Surrey to support people and answer their questions about immunization, make sure they knew where the clinics were and how to get registered. And there's a number of different strategies that we're working on in many communities to try and increase awareness. And it's not just in Surrey. We have a number of communities in Vancouver. There's communities around the province, up in the north east. We've had some issues around Terrace and Fort St. John that we're also doing outreach in many different ways in those communities as well. So these, we are moving, as the Minister said, into a different time now where vaccine will be much more available to everybody in the next little while. So we will be using all of these strategies. The thing about registering means that we can make sure that you get the information you need as quickly as possible and as efficient as possible. So those are some of the strategies we're using and will continue to use.
And there's a very significant effort this week in particular across Metro Vancouver in particular, led by the Premier, to reach out to people to encourage them to register. And if they receive an invitation to book. The issue in Surrey is an issue of transmission. It's obviously a very high level of transmission in Surrey. Surrey actually has a higher level of immunization than the city of Vancouver, the city of Burnaby, and other communities in Metro Vancouver, but we need it to be higher, and we need more people to register. There's a very high rate of transmission, as everyone knows. If you've reviewed the local health area data from last week, you'll see that. It's a significant situation in Surrey, and it's why we absolutely encourage everyone in Surrey, but really everyone in Metro Vancouver, to register, and when they're invited to book, but to register this week. And the Premier is leading an effort across communities this week to get that message out to everyone. And he'll be joined by community leaders, by mayors, by everyone else reaching out to encourage people to book. We're at a different moment. We've said for a long time that by the end of June, everyone will have their opportunity to be immunized. Back in February and March when we said it, it seemed a long time in the future. We're in May now. It is time. 1.1 million doses of Pfizer this month, doses in the hundreds of thousands of Moderna this month, and even more coming in June. So this is the time. We need everyone to register.